Hi, I'm Dr. Bate, the inventor of neuroliminal training. In my practice during the 80s, I became an expert in EEG biofeedback, and I found that this therapy was by far the best therapy known to solve virtually all mental problems, from insomnia to depression and even schizophrenia. In 2000, a Czech psychologist documented over 100 cases that had been cured or substantially improved by use of EEG biofeedback. NASA used it also extensively in astronauts and jet pilots in the 80s. Somewhere along the way, the name of EEG biofeedback was changed to neurofeedback, and the price of treatment went up, I'm sure. That's a major problem, cost. The electronic equipment is expensive, and the room which it's done in is in the high overhead class. Now add in the requirement of stressing the conscious mind so that each session is limited to a half hour, and the cost for 1/2 hour ranges from $50 to $200. That really limits the use of neurofeedback to the very wealthy. Solving a typical case of ADD by neurofeedback costs about $5,000 and up. In 2000, I started an EEG biofeedback leasing company. It isn't hard to teach any average person how to do this, so a parent can easily learn and can train a few sessions every day, thus cutting the overall cost in half or more. But even though the company was doing well, making money for me and saving for other people, I wasn't satisfied. So I continued researching, trying various combinations of audio signals and scripts. Before becoming a psychologist, I had been an electronics engineer, so I knew how those machines worked and how to build them. One day I was experimenting with some audio equipment, and a little psychic voice said to me, "Do it this way instead." I've learned to pay attention to that little psychic voice over my many years, and it worked. I had previously done a lot of research in my practice on hypnosis and done quite a lot of subliminal therapy. I had solved 3 cases of streaking, all from one judge, and a few actual breast enlargements per Ted Barber's work. These all use a repeating cassette and actually work better than expected. I decided now to use CD discs to get 77 or so minutes of repeating. I got some 42 men, women, and kids, all with general mental issues, and gave them all 60 days of nightly usage, reporting every week to a questionnaire. These volunteers proved beyond a doubt that this could work as well, or even better, than neurofeedback. Since this is on a CD, I decided to include some proven hypnotic scripts that work well for post-trauma stress. Last, and certainly not least, I wrote a lengthy article that includes getting rid of toxic minerals by only taking ascorbic acid, vitamin C, and some information on nutrition and digestion improvements. That article is free to download at http://drbate.com/content.integrated.html.